Well, hello, ladies and gentlemen. Wayne Elliott here with the Health and Wellness Show. My pleasure to be with you again and grateful to still be on this side of the grass, alive and well. Just recovered from COVID and that myocarditis. I was on with you last week, and geez, my glasses really make a reflection. Sorry about that. Um, but pleased to be with you today, and thank you for joining me. We've got a good show today, and we're going to focus at least some on men's prostate health and unwellness. One out of every two men during their life suffers prostate issues. My dad did. My dad's case, I didn't know he was on medication for a couple of years, and I guess didn't get the desired result, and he was actually booked for a prostatectomy, a prostate removal in Boston. And I convinced him because the heart drops had done such a good job for him that Boston Medical canceled his bypass surgery a few years before that, and uh, so I convinced Dad to take the prostate formula, Strauss prostate formula, and boy, my dad died about 15 years later with a healthy prostate, and I'm so grateful he was willing to try it. Well, then a few years later, I started with some issues, and I guess there can be many symptoms with the prostate, um, including very weak urinating. I know my experience was at one point I was getting up well, at least three times, but oftentimes four and five times through the night to the bathroom, and that certainly does disturb our sleep and um, ends our we can, especially if you have trouble getting back to sleep, that can be a real problem. So um, another, this is a strange one that I apparently, or people don't want to say, but it's a strange symptom is to when a man urinates, it can come out in two separate streams. And um, which I say, there's not a lot of men have told me that they have that, but it is another symptom I can tell you from personal experience. And the Strauss prostate, I've been back on it again now for about a month. I imagine I'll stay on it for 3 months and try and do the complete job. But one of the wonderful ingredients is the golden seal root, nature's antibiotic herb, and then many other fine herbs that are good for that part of our body. Um, Now, the other thing I want to say is that the Strauss Heart Drops, that's the company's flagship product to help the body have blood flow everywhere you have a vessel, vein, artery, or right down to the tiny capillaries to your skin. All that blood flow is necessary. Every cell in our body needs it. So, in my 28 or 29 years experience with the Strauss Heart Drops, when they sure helped me way back then, um, in our experience, it seems everything works better taken in conjunction with the heart drops. And it's pretty common sense, really, because if the blood, which is the only highway in our bodies, if the blood doesn't flow everywhere we have vessels and veins to carry it, well, then neither does anything else because the blood system is the only transportation system in our body. It carries everything, our life important oxygen for our heart and our brain, our whole body. But if we have too little to our heart or our brain, we can have a stroke or heart attack. Stroke is like a brain attack from lack of oxygen to the brain. And our brain uses 20% of all the oxygen that we take in our bodies. So it's pretty darn important. But that's only one thing that the blood carries. It carries medicine. It carries these herbal formulas, your vitamins, your food, your water, your wastewater, your cholesterol. Everything must go in the blood system. It's the only road if you think of it that way. So it's uh, therefore it sure helps these other formulas and ingredients get to where they're needed. And that's just been my own experience, is that the heart drops are just a wonderful supplement to take, because you do want that blood flowing everywhere you have a vessel to carry it. And of course, if you've got diabetes, blood flow is an issue for you. And I've just seen marvelous things with diabetics, these folks can lose their toes or their feet or their legs, their eyesight. And it's just so important, that blood flow. And people who have suffered heart attacks, have had open heart surgeries, have had bypass surgeries, you see, they can't just change all our hoses like they could in our car or our tractor. They can't do that. They do manage to bypass portions of our arteries. Um, excuse me, as far as I know, they can't even do the entire artery. So, of course, what they bypass is the worst restrictions, or the blocked arteries, of course, because no blood is not going to help anybody. There's definitely going to be serious outcomes with restricted, totally restricted blood flow. But they cannot change all our arteries. They can't change all our hoses, like in a tractor or a car. So you could have had bypass surgery and still have 30-40% plaque and cholesterol, from cholesterol build up in your arteries or veins. And not only that, of course, cholesterol and plaque is not limited to just our heart arteries. In our carotid arteries that go to our brain, up the sides of our neck, both sides, it tends to be like stringy fat, is the form it's in, but nonetheless restricts and can severely reduce blood flow to our brain. So neither there's no place that we have restricted blood flow that it's good. Uh, every cell in our body needs blood, and that's why there is some 50,000 kilometers of vessels and veins inside us. Hard to believe, twice around the earth, or each of our vessels could stretch, could go around the earth twice. It's almost impossible to believe, but it is true. And it's because every single cell, your hair on your head, your toenails, and every cell in between needs that blood. Um, so, it's just very important that we do our best to have full blood flow. And uh, but it's just important for our whole body and every one of our body functions. So that's why we always mention the Strauss heart drops. Folks, if you want to learn more about any of the Strauss formulas, they're wonderful formulas. You can go online to Strauss, STRAUSS, StraussNaturals.com. I'm going to put that at the bottom of the screen. And the coupon code is TRUTH, just like the name of the radio network, Truth Be Told Radio Network. Well, the code word, the coupon code is TRUTH for an automatic 10% savings. And the Strauss Company realizes, of course, we're all suffering inflation and uh, higher taxes, higher costs of everything, it seems. And so if you use the coupon code TRUTH, you'll have a 10% savings on any order. And or you can just learn more information. That's at StraussNaturals.com. And there's a toll-free number as well. You can speak to one of the wonderful ladies there at toll-free at 1-866-478-2873. It's on the bottom of the screen there, 1-866-478-2873. Or contact the website, and I'll put that back on the screen, StraussNaturals.com. Coupon code TRUTH, the word TRUTH, for 10% savings. Yeah, this issue for men, this prostate business, it surely is serious enough when you consider that 1 out of 2 of us will have problems in our lifetime. And those problems can range. We'll be having Dr. Michael Garko on shortly, and he'll give us a much deeper explanation of some of these things, but there are a number of things, a number of issues, I guess, can happen with us in our prostate that where we require help. And uh, in my experience, the Strauss prostate formula has been a wonderful, 100% natural, painless um, way to help yourself. And the other thing I've always loved about the Strauss company is they refuse to have a dissatisfied customer. And so, for any reason, if you're not satisfied, you simply get a full return of your money, no questions asked. And I like that people can know that there's no chance for them being ripped off or taken for their money. Money is hard to come by and hard to hang on to these days. So there's never been a more important time to be conscious of folks' money. So you can't be cheated for your money or be unhappy and be out your money. The Strauss people would have a bleeding heart if they couldn't help you, but you will not suffer the loss of your money. And and we hope you if you when you have good results, you'll tell family members, loved ones, friends. It's why I do this. This is not by any means my main business. I'm a recycler and an environmentalist, have been for over half a century now. But ever since my own tremendous luck with Strauss 28 or 9 years ago, and everyone that I've been involved with since, including both my parents, it's been a wonderful experience. And I just want to scream it from the top of the mountain, as Jim Strauss used to say, to in the hopes that other people will give it to themselves and uh, try the Strauss Heart Drops for sure. But they have a wonderful line of products. The bladder is a wonderful product and has helped many men and women, myself included, my mom included, and the kidney support formula. Oftentimes, kidney is the cause of our high blood pressure, and so the kidney support formula has done a great job. And they all have that golden seal root, which is nature's antibiotic herb. And I see we've got my favorite PhD, my favorite doctor, the most educated man I know. Dr. Garko is with us. Dr. Garko, great to have you back.
Well, nice to be with you. You look a lot better and better. You sound in better spirits than the last time I saw you. I know you've had a bad patch there, but you seem to be recovering quite well.
Yeah, I wasn't myself last week, Doc, when did the show together. I must admit, and I hate missing the shows, but yeah, I'm feeling better every day. To tell you the truth,
Good.
I had that myocarditis, folks, after having COVID, and still every time I do anything, including walk upstairs, my heartbeat goes out of rhythm. But when I'm resting now, it's pretty much always in rhythm. So, and I'm drinking that cardio calm formula of Strauss. I'll tell you, I've gone through 2 bottles in 3 weeks, I guess. So I just know it's going to help me the way it did the first time all those years ago, and I'm going to stay on that. But very unpleasant experience, Doc. That's for sure.
Yeah, I
Just
know.
before you, just before you joined us, I was talking to the folks. Said we were going to focus on men's prostate today, and I know you could
Wonderful.
tell us a lot about that. And I
Yeah.
was just talking about, Doc, some of the symptoms,
Mm.
including my own, that I've had. Getting up to the night too many times, or very weak urinating stream, and one that actually that I've had that I take it isn't too common because I haven't had a lot of men tell me this is your urine will come out in two separate streams. It's
Oh,
very
yes.
odd, and I've
Yeah,
experienced that myself. So you can maybe tell us more about different symptoms and what to watch out for
of
and
course.
why they're happening to us, Doc.
Yeah, of course. Now I know this is a man's issue or a men's issue. However, the women that are watching this podcast today should also pay very close attention because men are notoriously derelict in going to the doctor. And it's usually the women in their life, their wives, their mothers, their daughters, a girlfriend, whomever, that eventually gets many men to see a physician. So just as men need to be educated about this particular issue, and it's a serious one, so do women, so that they can help the men in their life, whether that be your father, your brother, whomever that you consider very important to you. Wayne was alluding to the symptoms and how this is talked about in the literature and in the medical world is benign prostatic hyperplasia, BPH, with lower urinary tract symptoms. And they abbreviate, the acronym for that is LUTS, L-U-T-S. Now, this is really, Wayne, the bane among aging men. And BPH is what is referred to as a histologic diagnosis. What that means is there's a microscopic examination of cells and tissues referring to a notice my language, non-cancerous enlargement of the prostate gland, which is caused by the proliferation of what smooth muscle and epithelial cells located within the what they call the transitional zone of the prostate. In other words, the prostate is an organ whereby the urethra runs right through the center of it. The urethra connects to your bladder. And as the prostate begins to enlarge by the proliferation of these cells, it begins to enclose or crimp down on the urethra, then makes it far more difficult to urinate, and sometimes can be very painful. Now, not every man that is clinically diagnosed with BPH will develop these lower urinary tract symptoms, which I'm going to delineate for you in a minute. But not every man clinically diagnosed with LUT suffers from BPH either. So, but I can tell you from my experience and what the literature says, more often than not, men that are 50 years of age and older have issues with their prostate. I once interviewed a physician when I was doing Let's Talk Nutrition, my own show, and he said on air, he said, you know, men, if they don't die of an accident or some other serious chronic disease, will eventually die of prostate cancer. Well, I would sort of modify his statement and say, men, if they don't die of some other chronic disease or diseases, don't die of an accident, and if they don't take care of their prostate, will eventually die of prostate cancer. So you have to do prevention and preparation with respect to the prostate. Now, it's a common problem. It affects the quality of life of men. I know there are many men watching today can testify to that. About 1/3 of men older than 50 years of age will experience BPH symptoms. Now, you know, this is in the abstract as I say it, but the complications associated with BPH include, as Wayne was alluding to, renal insufficiency, renal failure, acute urinary retention, meaning holding of the urine, blood in the urine, urinary tract infections, damage to the bladder, damage to the kidneys, and then the formation of kidney stones. That's some of the complications. Now, some of the symptoms, you can break them out, Wayne, into two categories. You can talk about voiding urinary symptoms, which are hesitancy. You have to strain to urinate. Straining during the voiding of urine can be very difficult. Slow urinary stream, a weak urinary stream, splitting or spraying of urinary stream, which you referred to. Yes. Intermittent urinary stream, where you urinate and then it stops, urinate and you stop. And then there's this, what they call terminal dribbling. At the end, you think you're done and you walk away, and next thing you know, there's more that dribbles out and goes on to you and your clothing and whatnot. Yeah. And lastly, there is pain in varying degrees during urination. Those are voiding symptoms. There are also bladder storage symptoms where you have incontinence, retention of urine, nocturia, where you have to get up multiple times during the night, frequent needing to urinate during the day, and compelling, you can't wait to get to the bathroom. You can't go on a long trip because you're always having this compelling urgency to urinate. So those are some of the symptoms and complications, Wayne.
Yeah, there are many, Doc. And tell me, uh, do do these prostate troubles uh, ever or regularly have to do with male impotence and erectile dysfunction and so forth?
Uh, with one of the complications is, that is a tough call. I wouldn't say, only to the extent that men who have very enlarged prostates uh, have very difficult time performing, if you know what I mean. And it just creates a problem to be able to perform that way. I mean, to say that it's directly connected to impotence and it is connected to incontinence, where you can't hold your urine. But
Right.
impotence, I wouldn't necessarily make that leap.
Okay. Okay. Um, so what I've seen this lately, Doc. Probably on Facebook. Is there any truth that you know of that there's a benefit before bed to having a warm a cup of water specifically for the prostate?
Well, men again have advanced in BPH, meaning that the prostate is about as big as a regulation NBA basketball. If you get my meaning, I mean,
Right.
it's really enlarged. If you drink anything a couple of hours before you go to bed, you're probably going to have to get up and go to the bathroom throughout the night. You already have that propensity to do it. Now, if you're taking in liquid and you just can't hold it, you're going to warm water, cold water, tepid water, anything that you drink is going to increase the odds and the frequency of having nocturia or having to get up during the night and urinate. And I can make one other comment about this benign prostate hyperplasia. If you think it's going to self-correct, you're mistaken. It will not self-correct. And once it's very enlarged, it is, the truth be told, it really takes a miracle almost to shrink it. I mean, without doing particular surgical procedures. Once it's enlarged, I mean, you're gonna see on the internet, they're gonna say, if you take this or that, it's gonna shrink your prostate to normal size. I don't think so. Maybe in the early stages, you might have a chance at that, but in advanced stage BPH, the odds of that happening, I mean, I'll probably be an astronaut before that happens.
Huh. And Doc, what about this is the non-cancerous that you've been talking about.
Right.
What exactly happens when we get prostate cancer, and how often does that happen? Do you have any percentages? Is it half the men that have trouble it's cancerous, or?
Yeah. So, I've had a close friend of mine several months ago contacted me, and he was diagnosed with prostate cancer, and he was just scared to death. And for good reason. He asked me to help him, and I helped put his oncology team together. He didn't even have an oncologist. He had to have, surgery. They had to remove the prostate. They did a prostatectomy. Unfortunately, they didn't catch it in time, and it metastasized to his spine. And now they're having to treat it for that. So what's my point? Prostate cancer is serious, very serious business. And it's not something that you really want to mess around with. 1 in 8 men in their lifetime will most likely be diagnosed with prostate cancer. Again, that's a lot.
Yeah.
And it's attributed, it can be attributed, there are many risk factors for prostate cancer. Diet and lifestyle play a very, very large role. Now, prostate cancer forms in tissues of the prostate gland, and the prostate cancer is one of the most common types of cancer in men, and it usually, fortunately, grows slowly. And initially, it will remain confined to the prostate. But if you let it go, disregard it, and just think that somehow it's going to go away, it will metastasize like it did to one of my friends. Growing slowly is a benefit. And if it's detected early, you can confine it to the prostate gland, and then you have a good chance of surviving the prostate cancer. Common signs of prostate cancer is very similar to BPH. That's why they get a little confused. Difficulty urinating, urgency to urinate, frequent urination at night, that's nocturia, burning or pain when you urinate, inability to, the same, painful ejaculation with prostate cancer, and blood in the urine or semen. Those are the painful ejaculation and blood in the urine, semen are not so much associated with BPH as they are with prostate cancer. In terms of age, the chances of getting prostate cancer rise quickly after a man reaches 50. It is more common in men of African or Caribbean descent, and it's less common, but believe it or not, and interestingly, in men of Asian descent. Family history plays a role. If you have a brother, a father, uncles who had prostate cancer, you need to pay attention to that. Diet. If you're eating a diet high in fat, high in sugar, lots of alcohol, and smoking, you increase your rate of having prostate cancer. The diet low in fiber and high in fat. Lifestyle, being sedentary, smoking, drinking too much alcohol, lots of stress, being overweight or obese increase the chances. So those are some of the risk factors. It's serious business, and so it needs. But the good news is, if you catch it early, they can confine it to the prostate. They can keep it within that chamber, and there are a number of surgical procedures that can be done to save your life.
Is prostate cancer always treated with surgery, Doc?
No, sometimes it's not. And usually it's not, because it's too risky for men. For example, there may be already existing scar tissue in that area, and the surgeons have a difficult time going in there to even remove the prostate, and they'll elect not to do it. They may have had some colon issues and had their colon resected. They got scar tissue, so that will prevent it. So sometimes they can't do surgery, and they'll treat it hormonally with medication, and they shut down the production of testosterone. Testosterone is uncontrolled, can be a risk factor here for the prostate cancer. So they treat it hormonally, and they shut down your production of the testosterone. So not all the time do they treat it with surgery by the removal of the prostate gland, which is called a prostatectomy, and that has risks. You can become incontinent or impotent if they accidentally or inadvertently cut nerves, and there's a lot of nerves in that area. And you got to be careful because once you cut those nerves, that you cannot put them back together. Yeah. So there is a risk with a prostatectomy to suffer incontinence and impotence. But you know what? Men, when faced with, if you don't have the prostatectomy, you're going to die, they will take the chance. And the chance, it's much better now, Wayne. They do the surgery robotically, And there are surgeons that I know who have done thousands of these. And that's the surgeon you want to find if it gets down to that. You want to find somebody who has done, so 1,000 or more of these kind of operations. That practice makes perfect.
And when they do the surgery, doctor, they always remove a complete removal of the prostate, or is it like the intestines where they can take some of it?
They typically don't want to do that. Usually it's, in for a penny, in for a pound on this one, I think. I'm not a surgeon, but I suspect the surgeon would say, look, you got prostate, and they can tell how serious it is, the Gleason scores and whatnot. And if it's if they have an aggressive form of it, the surgeon's going to say, we got to take this out. We got to remove it. Now, I know that some people are reluctant to do that. Some men are very reluctant to do it, and they go off to Mexico or some other place, some far land, and do some peculiar therapy treatment that was promised it's going to cure the prostate cancer. There is no evidence that works. Right. I'm trained as a scientist, and my motto is show me the data. Show me the data.
Yeah, yeah. So it's like anything else, doc. Prevention, even though a lot of us like me don't acknowledge it earlier in our life, prevention's pretty important for our overall health, but the prostate's no exception.
100%. And also, you hear me say, Wayne, it's prevention and preparation. And by preparation, I mean, as I often say, the metaphor I use, we can prevent a war. Oftentimes, a country will be able to prevent a war. But is it prepared to go to war? That's a big difference. Do you have all of the armamentum, all of the resources to fight that battle? And so what I'm suggesting is sometimes people will practice prevention, but they don't go far enough. You need to make sure that you build up an inventory of health, that you have good physical health, mental health, spiritual health. And because look, I know this is hard to talk about, but we're all going to pass away. And if we don't die of an accident, we will die of some disease. And that's a fact. And so it's just a matter, but you don't necessarily, if you're confronted with a serious disease like cancer or whatever it may be, maybe you are prepared to fight that battle, that you have taken care of yourself and will, succeed in the battle. Eventually we all leave this planet for one reason or another, but we don't have to leave it sooner. We can leave it later rather than sooner if we build up that inventory of health. So it's prevention and preparation. I'm so glad that you're talking about this today, because this scares the bejesus out of men, Wayne.
Yeah.
It does.
Well, doc, I don't always practice what I preach myself, and I take a lot of supplements, and of course I take some of the Strauss formulas, and I kind of rotate them. Well, I've had these symptoms, and I've really been. I always get mad at myself for doing this, but I've been when it comes to the prostate, I've been taking it like once a day. When I wasn't feeling well the last couple of weeks, I was taking more of other things like the cardio support and some of the things to help me with that virus I had. But because I always say to folks, there's great antibiotic herb in these formulas, the prostate, the kidney, the bladder.
Yes.
And I've got to get serious now, and which is what I'm going to do. I started a couple of days ago of taking it 2 or 3 times a day.
That's wonderful.
Religiously, and I'm going to take a few bottles till these symptoms are gone, like the last time. There's nothing to play with this.
No, it's not. And I would remind the viewers today that Strauss is a wonderful company. This is a company with a lot of, that's why I've been in this business a long time. And people that know me, I just don't endorse anybody. I don't. I
Right.
Strauss is one of the very few companies that I have put my name, my reputation, and my support behind. I believe in the company. It's a good company. It's a family-run company. I love the formulations. They have integrity, and they've been around for 40 years. So when I come on and talk about the Strauss products, I can tell you it's heartfelt, and it's, as much as a scientist as I like to think I am, I'm still a human being. And I look to see the people around me and people and companies I'm affiliated with are good people and good companies.
Yeah.
And they're even, they're going to try to even help people get the products at a discount. And I know that they have a code for them, right? That they can get a 10% discount.
Yes, I've got that on the bottom of the screen here, and I was mentioning it earlier. For the coupon code word is truth, for a 10% savings on any order, any products. And yeah, we talked about that earlier. It's not getting easier for people with inflation, Doc. There's less and less, uh, disposable income, it seems, all the time. And it doesn't seem to be changing. I don't know if it's going to change. The price of gasoline, the price of groceries, it's really something. And I'm glad. And the other thing I love, as I was saying earlier, Doc, is the satisfaction guarantee.
Oh
It
yeah.
shows,
Oh,
you know,
you know what? Again, I've been in this business a long time. You're hard pressed. I mean, you got to look hither and yon to find a company that'll give you 100% unconditional guarantee if you don't like the product or it
yeah,
didn't work. For
yeah,
heaven's sake, you have nothing to lose, man.
yeah,
And oh, by the way, the prostate drops, the support drops by Strauss, they taste, for me, they taste great.
yeah,
It's easy. This is an easy thing. This is a hack on how to help your prostate. You got
yeah,
a bottle, you unscrew it, and got a dropper, you squeeze it and put it in your mouth. You're done. I
yeah,
mean,
yeah.
you don't have to scale a mountain here to do this.
No, no, I love the ease of that, Doc. And I guess with my vitamins, minerals, and all, I probably take, well, about a dozen different things in a day. But it's just easy, It's 5 minutes with a glass of water, and some of them are capsules, of course. And I like that the Strauss formulas are liquids because they are easy. There's no issue swallowing them. Some people do struggle with a lot of capsules or tablets.
They do, and especially elderly folks who've had issues with throat issues, esophagus issues. So the in the world of herbal medicine, something is in a liquid form, it's called a tincture,
Yeah,
and these are all tinctures. The Strauss, they're liquid and easy to get into your system. And I like the way the prostate drops taste, and it wouldn't. You can't reach any toxicity level with that. I mean, it'd be very difficult. So you can take as much as you want. Really, quite frankly, if
yeah,
you took it 2 or 3 times a day, that would be great. Um, I can tell you. You asked me about the statistics. I mean, numbers can be deceiving, and there's all kinds of cancer that are floating around. And with prostate cancer, I've seen different numbers. Um, system, and I sometimes am reluctant to report on it because they're so different. But maybe next time we talk about this, I will nail it down where I'm comfortable on reporting it. I don't want to represent something that's not accurate because they're so varied. I look at the CDC, then I look at another outfit and another outfit, and I'm getting different numbers all the time. It's crazy. I don't know why, they can't settle down on it. They say, like the CDC says, out of every 100 men, about 13 will get prostate cancer during their lifetime, and about 2 to 3 men will die from prostate cancer out of 100. That's from the CDC. I
right.
mean, think about that. That's that's pretty alarming.
Yeah,
So nothing to mess with. And you know, if you've been diagnosed with BPH, you may be taking a drug, something like Avodart. Uh, that's a good drug. Um, I take it myself, but I also take my prostate drops by Strauss to support even more, have more support for my prostate. So if you're taking a drug, it's okay to take like Avodart. It's all, the generic is called Dudasteride. It's okay to take the Strauss heart drops. I've been doing that for years.
Yeah. Yeah. There's no contraindications with any pharmaceutical drug, doc. It's really more like food and drugs. You know, these herbal formulas are, I think, closer to food, 100% natural. And there's never been a report in all these years. I think it's 43 years now, to Health Canada, the FDA, or the Strauss Company about any serious side effect from any of the formulas, or any harm certainly done to anyone. And I do like that about it too, because I always encourage people, doc. So many people are on pills of one type or another, pharmaceuticals today, and it's kind of shocking, and it bothers me that so many of them never read the paperwork. And
Mm,
this, not to say, God bless the doctors and pharmacists. They're there to protect us, but they're human beings as well. And here in Canada, it was pretty shocking a few years ago. One pharmacist we thought was in trouble. It was in the newspaper because he had a regular customer that came to his pharmacy that was on a number of pills. One of the doctors put him on another formula, or more than one, and there were serious contraindications.
hmm.
And so they I guess they chased down the pharmacist, and I thought he was gonna, I didn't know what he was gonna say, and he said, "You have to understand, we're too busy now to really do what we're supposed to do. The pharmacist's job isn't just to count pills and put them in a bottle with a label on them, telling you how many times a day to take them.
Uh-huh.
That's like our last line of defense in case there's a medical error giving us something that does contraindicate with something that we're already taking. So I always encourage folks, read the paperwork.
Yep.
And then if something is going wrong with you, at least you can talk to your doctor, who may choose to change you to another type or change your
Sure.
dosage. But if you don't say anything, of course, you're at risk.
What I do with my clients, I encourage them always to, like, if they buy Strauss products, I said, go to the Strauss website, straussnatural.com. Read the literature that they have there on the products. Like the Strauss heart drops also, are terrific, and that's the flagship product, and I would urge people to recommend. I recommend it. But with the prostate issues, I also have my clients. And I encourage them to take the kidney support drops as well, and in some cases, even the bladder support drops. It's all part of that urinary system. So I'm doing like a multifrontal um, nutritional medicine approach
Yeah.
to treatment approach to the issue. So, and some of my clients are very compliant, and I have good relationships with them, and I just don't lackadaisically recommend take this, take that.
Of course.
So
Of course.
they'll do the heart, they'll do the prostate support drops, they'll do the bladder and the kidney all at the same time to keep that whole urinary system functional.
Well, it's a great point, Doc. And I think that, again, not to be down on Western medicine, but in my experience with some friends, uh, they sort of treat one thing at a time. And it's almost like uh, not believing that everything connects in our body. Everything connects. So you may you may take one of the formulas for one thing. The heart drop's a great example, and recognize other benefits that have happened to you. You sleep better, or you're calmer, whatever the case may be. I love that about these because you may be taking something for one specific purpose, but to get other benefits that you notice is just the cat's meow. And it's proof that everything connects. I mean, our whole blood system is connected to every cell, doc. So,
Of course.
everything we do affects everything that happens inside us, doesn't it?
Yes, and 100%. We are a reflection of the cosmos and the universe. Everything is interconnected. Everything is relative to everything else, and that's the way it is. You mentioned earlier something about this is food. It is food. Herbs are derived from plants,
Yes.
and so it's another form of food. And the prostate drops is a formula. It's a unique combination of naturally sourced and studied herbs used traditionally to support a healthy functioning prostate, as well as a healthy functioning urogenital system and urine flow. And that's why I sort of take a systemic approach here. To your point, everything's interconnected. So I'm looking at the bladder, I'm looking at the kidneys, and then the prostate. And I say, you know what? Maybe we treat all that whole system to get an overall better effect, even though it's just a specific prostate issue.
Yeah.
The prostate drops have saw palmetto in them, bilberry leaf, nettle leaf, juniper fruit, birch leaf, corn silk. It has linden leaf and flower, white willow bark, golden seal root, and uva ursi. I can tell you, as a medical researcher, there are hundreds, if not thousands, of studies on each of those herbal. When you put them all together, taken together, you will find more literature than you have time to read regarding all of those herbs that are in the product. So this is a well-designed, developed, formulated product that the Strauss family did a great job. I love the product.
Yeah, yeah, I sure do myself, doc. I'm so thankful, for my own life, and really have had good health since the heart issues. Another kitty cat, just Cadillac, any other old expression you can think of, combination is the Strauss heart drops and the cardio support. And that
100%.
cardio support I took years ago, 28, 29 years ago, because of my irregular heartbeat. I had supraventricular tachycardia. And taking the heart drops, I mean, I thought I was Superman, and I truly was a new man after a few months, increasing my blood flow. But that arrhythmia did not go away by
Yeah.
taking the heart drops. And then Jim Strauss told me that the cardio support was really for two things: the most difficult heart condition to treat, which is irregular heartbeat, and as well helping the body repair damaged heart cells. And up until maybe 30, 25, or 30 years ago, it wasn't believed that heart cells could be revived. And truth of the matter is, doc, in a lot of cases where blood has been cut off or greatly reduced to part of our heart, and then it is supplied in full larger amounts or in full 100% blood flow, uh, this has happened. And I remember years ago, a number of people say, I felt something myself in my chest one day, but I wouldn't, it sure wasn't a pain and it wasn't a cramp, but it was almost like someone opened the tap and I felt this rushing. And I've had
Mm,
literally hundreds of people tell me the same thing. But the other interesting thing was that sometimes people would get like a cramp in their heart and be afraid.
yeah.
And Jim Strauss used to explain that, if you had a cast on your arm, if you had a cast and a sling on your arm or on your leg, and your leg was straight in a cast, you'd be a little while after you got the cast off till you could bend your leg again or to straighten
Yeah.
out your arm. And the same thing with your heart. If part of it hasn't been getting blood and hasn't been working properly and then does, so I was just amazed at how many times that happened where I was involved or talked to the folks. And it's just great news, that some of this damage can be repaired, and our bodies can do that.
Well, we have various systems of the body, and it's always interesting to hear debates about which system of the body is the most important. Is it the neurological system, the cardiovascular system, the digestive system, whatever? The fact of the matter is they're all important. They all interconnect,
Yeah.
and they're all interdependent. But if your cardiovascular system is compromised, you're going to have a lot of difficulty supplying fresh blood and oxygen and nutrients to every cell, tissue, and organ in your body. That can have grave consequences. I would remind the viewers today, there's two things that are important to remember here. One, the products from Strauss are guaranteed, no questions asked. The phone number, if you go to the website, you can get the phone number and call and talk to the folks. They're so nice to talk to, and we'll explain all of that. There are no questions asked. And the other is like for today, they're having a 10% discount. If you use the promotion code TRUTH, TRUTH, the truth, the truth be told, you can get a 10% discount. So those are two nice features. You have nothing to lose. I don't know, Wayne. I know that we all are faced with health issues sooner or later, in one way or another, for one reason or another. And you can practice prevention, which I encourage, and we have to practice preparation. Even if you don't have, let's say you're a male watching this and you're 40 years old and you're not having any issues with your prostate. If you were my client, given what I know about what the future can bring, I'd say, practice a little prevention, take the prostate drops. Oh, okay, you don't have high blood pressure or heart disease. You know what? Practice a little prevention, take the heart drops. Yeah. What do you have to lose, man? The best investment is your health. So prevent and prepare, prevent and prepare. That's my motto.
I feel the same way, Doc, with some of the major things, like our number one killer, heart disease, as I'm sure you do. I've known many people, many family members, many friends that have had heart attacks, and sometimes they're fatal. But when they're not, it's sure no joke. You talk about recovery, and gradually building up strength in the heart and so forth. I remember one of my uncles. I think what killed him in the end was he had a heart attack, and they told him how much he should go out and walk every day, and he was so afraid and nervous of the next heart attack that he was fearful about doing any of the exercise or walking, and then sure enough he did have it, and it took him away. So it's so much easier to prevent than it is to come back from one of these major health events. And
no question.
Diabetes is, I don't know if a lot of people realize how serious diabetes is, and how there's 4 or 5 times the chance of heart attack and stroke for diabetics. And of course they can lose parts of themselves, limbs and everything else. So that blood flow, I don't know. As far as I'm concerned, it's the number one body function. Without that,
exactly. No, you have no blood flow. You have no oxygen to the cells, and you're done. I mean, that's it. This is how it works, and you're 100% right.
But there's no unimportant parts of us, Doc. You know what I mean? They didn't put any spare parts in there.
Yeah,
your liver's gone, so that'll be all right. No, it won't be all right.
Yeah, you're not like one of those old Lincoln Continentals with a spare tire in the back bumper.
I've always felt strongly about trying to stick with the original parts too, Doc.
Yeah, 100%.
I was so lucky playing ball and being an athlete and being a rough and tumble guy in my youth. If you count the same ones, I've broken 40 bones, and
oh my goodness.
Each ankle 3 times, every rib at least once, my sternum twice, fingers, arm in 4 places, 2 bones in 2 places. And I know I've been so lucky, Doc, because they wanted to do my arm, and believe it or not, it healed. I still don't have arthritis 17 years later,
That's
and,
amazing.
and I refused the surgery. But you know what I've noticed with all my friends that have had the surgeries, football players, shoulder surgeries, knee surgeries, elbows, hips, it is tougher to try and come back to 100% once they've cut into
Yeah.
you and cut those small nerves and blood vessels. You're no, and of course, put pieces and parts in you. You're no longer 100% natural yourself.
Yeah, you walk around and you go to the airport and you set off the alarm for all the metal. I get it. It's but we want to try to get ourselves look to trade. One metaphor I use: you don't want to farm out your health, wellness, and well-being to subcontractors.
Yeah.
You want to be in charge of your health and wellness. You need physicians. You need the medical community. We all do, in one way or another. But you want to be in charge of your health, and don't just sit there and wait until something happens, and to take the initiative
Yeah.
and it's never too late. By the way, I don't care if you're 80 years old.
Yeah.
I've seen studies. This is true. Where they had people who were in their 80s that were non-ambulant, they couldn't walk, and put them on lifting weights, doing resistance training,
Yeah.
and they benefited from it. Some of them were even able to get up and move.
Yeah.
So the studies are out there. It's never too late, and just take charge of your health. Do it today.
And at least, Doc, be a part of it. There's so many people that aren't a part of it today, and I get it. You have a great deal of education. I've had just this almost 30 years experience with Strauss and talking to so many people, but um, at least be a part of it. If nothing else, on the caution side, check yourself to make sure that there's no contraindications if you're prescribed a new pill. We can't expect these doctors and pharmacists to be perfect. Oh, I started to tell you the pharmacist story. Well, the next day in the paper, the association, I guess, of pharmacists here in Canada said, we haven't got time to look through your history and everything that you're on when you come in for medicine. And I thought that was really scary because
Hmm.
there is no second line of defense for us. So that's why I tell folks to, it takes 5 minutes. Read your paperwork, because if something's not going right for you, you want to be aware of it so you can talk to the doctor, and
Yeah.
just to simply accept everything that comes along, like you're saying, take charge of it, but at least be a part of it so that you're and I'm afraid that most people, Doc, are not so much a part of it. I used to
Yeah.
joke at lectures and say, folks, if the doctor told you to go home, go out in the barn, get a big pitchfork and eat, you know what, you'd do it. And they'd laugh. And I'd say, no, no, you'd do it, but which is an exaggeration, of course. But I was trying to make a point that, be part of it yourself. Be
Sure.
part of it.
That's right. Use your critical thinking, make good judgments, listen to what your doctors and other medical care professionals are saying to you, but you don't just want to take things without your own scrutiny and examination of the issues, and to see what's in your best interest and to ask questions. Any good
Doc,
doctor.
I've never seen it as part of a clinical study, but I think a pretty important criteria is, how do you feel? And so we know how we feel. And, if you've started on a new pill or started on anything and it's making you uncomfortable or giving you indigestion or something, well, that's something to look into. But my wish is that folks would be a bigger part of their health. And certainly,
Well,
I think we can trust nature. I think nature had everything perfect. And I, like Jim Strauss, really believe that in the original natural forms of foods and such, is that nature provided everything that we
well,
need, and it's not the
Well,
case today.
it did. I mean, in
Yes.
fact, what we are today, from our ancient ancestors, what they ate and how they lived determine our genetic destiny and what we are. These biting, look,
Yep.
it's about biology. And as I told you on our last time I was with you,
You
you
can't beat it.
can't bargain with biology and you can't
No,
cheat biology. You
that's for
can't,
sure.
man.
No, 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 you're right. Doc, we're at the end of our time. Geez, we're 30 seconds till cutoff time.
Well, don't forget the 10% discount.
Oh, yes.
Truth.
Truth
Do the
coupon
truth.
code truth for 10% off, folks. Thanks for joining us today. Thanks always to my wonderful friend and special guest, Dr. Michael Garko. I've never not learned something in the, I guess, I don't know, 100 times I've been on the radio with Dr. Garko. So thank you again. Until next week, folks, God bless and good health. Thank you. We'll see you, Doc.
Very good.